My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a GLP-1 receptor agonist, is a powerful tool for weight management that offers a notable advantage by specifically targeting visceral fat. Visceral fat, unlike subcutaneous fat that lies beneath the skin, accumulates around internal organs in the abdominal cavity. This type of fat is highly active and associated with increased inflammation, insulin resistance, and other metabolic dysfunctions, elevating risks for chronic conditions such as heart disease, type 2 diabetes, and certain cancers. Here's how semaglutide assists in reducing visceral fat and lowering the associated health risks. Visceral fat is closely associated with insulin resistance, a condition in which the body's cells become less responsive to insulin. When visceral fat accumulates, it releases free fatty acids and inflammatory molecules into the bloodstream, which interferes with insulin function. Semaglutide not only helps lower blood sugar levels by stimulating insulin production, but also improves insulin sensitivity, making cells more responsive to insulin. As visceral fat is reduced, there's a corresponding improvement in insulin sensitivity, helping to prevent the development of type 2 diabetes and mitigating blood sugar fluctuations. One of the primary dangers of visceral fat is that it secretes pro-inflammatory cytokines and adipokines that elevate systemic inflammation. Chronic inflammation is a significant risk factor for cardiovascular disease, as it contributes to plaque formation in arteries and can lead to hypertension. Semaglutide-induced weight loss helps reduce the amount of visceral fat, thereby decreasing the inflammatory response and oxidative stress. Studies show that reduced inflammation due to lower visceral fat can have profound benefits for heart health and may reduce the risks of stroke and other cardiovascular events. Visceral fat impacts blood lipid levels by increasing levels of triglycerides and LDL cholesterol, while often reducing beneficial HDL cholesterol. Elevated triglycerides and LDL cholesterol are known risk factors for cardiovascular disease. By reducing visceral fat through the appetite-suppressing and weight loss effects of semaglutide, patients typically experience improved lipid profiles. A healthier balance between LDL and HDL cholesterol, combined with lower triglyceride levels, is associated with decreased risk of heart attacks, atherosclerosis, and other cardiovascular issues. Visceral fat has a strong link with elevated blood pressure due to its effect on hormones and inflammatory markers that influence vascular health. The reduction of visceral fat through semaglutide not only helps lower blood pressure but also reduces strain on the heart and arteries. Lower blood pressure, in turn, reduces the risk of heart disease, stroke, and kidney damage. Semaglutide's benefits extend beyond weight loss alone, as improved blood pressure levels further contribute to a lower risk profile for cardiovascular diseases. Visceral fat is a key component of metabolic syndrome, a cluster of conditions that includes hypertension, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Metabolic syndrome significantly raises the risk of heart disease, diabetes, and stroke. Semaglutide's ability to reduce visceral fat contributes to improvements in these markers, helping patients achieve healthier waist circumferences and better blood pressure, glucose, and lipid levels. By addressing multiple components of metabolic syndrome, semaglutide aids in mitigating the cumulative risks associated with these conditions. Visceral fat is also associated with limited physical mobility and increased pressure on joints, as it often correlates with an overall higher body mass index, BMI. Semaglutide's weight loss benefits make it easier for individuals to engage in physical activity, further reducing health risks associated with obesity and excess fat. Physical activity, in turn, promotes a healthier metabolism and supports long-term weight maintenance, which is crucial in preventing the reaccumulation of visceral fat. Reduced joint stress and improved mobility contribute to a better quality of life and lower the risk of conditions such as osteoarthritis.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.